I'm using Purison to clean her skin. Hypochlorous has actually been proven to be really effective. You can clean off any needle that, like anything that were to drop. Hypochlorous is actually preferred now. The other thing I use is in that little green hand soap pump thing there. That's wintergreen alcohol. I've used that for 18 years. I like wintergreen alcohol. It's a little bit nicer smelling than standard alcohol. And it does get the skin. It's 70%. So I tend to do both of those. All right, let me mark her. Can I have some ice packs, Cynthia, please? All right. So if I'm marking her, the left-hand side, sorry, Shane. So if I'm marking her, I'm going to look at bony structure. Okay, we have temporal fusion line, we have zygoma, we have her gonial angle, and we have her chin. So those are bony landmarks I'm going to pay attention to. We also want to make sure we're thinking safety. We have her infraorbital artery. There's a notch, and I'm going to say it's right there. We have her angular artery that we need to pay attention to. So coming up here, we have inferior labial, superior labial, branches to angular, comes up, supratrochlear, goes up. And then we have the infraorbital right there. So these are things that you want to pay attention to. We also have here, there's also superficial temporal artery. We're not really going to mess with this on her. She has really good temporal volume, and she's very strong here. I pulled, smile really big. You can see she has a dip right there. She has a dip right there. Structurally, there's a ligament there, the zygomatico-cutaneous ligament. You're going to notice that most patients who lose weight or get into a certain age, women of a certain age, they have a dip right here. I want to extend this so when she smiles, it is one long line. So it looks, I don't want to add a lot of width because she already has good breadth to her face. I don't want to add that. That's the artistry, what we're doing. We want to keep this relatively same breadth, but I want to fix this dip right here. I also want to come into here and make this a little bit better. We have to be careful of this malar fullness because this is genetic on her, and it is not easy to fix. I don't know of any way to truly fix this. I have not met a surgeon or a doctor that can truly fix this.
I can get swollen there easily.
Yep. And your toxin probably makes it worse, which is why you don't like toxin around your eyes, right?
Yep.
Right. Structurally, she has lost support at the piriform fossa. She has her ligament that goes here. She actually has a little bit of loss, but if we put too much volume there, it might slide right down that ligament, and it won't. So I'm going to use product to actually support here. I'm going to use products to support at the lateral face. I'm going to come in piriform fossa, and then I'm going to actually use sculpture in a different way for you guys. Not the way I love to use it, but I'm not doing her sculpture series. She can go pay someone else to do that because that's what she's already done. So we're going to let her go back to those people and let them finish it. But I am going to show you structurally here that we can use sculpture in the skin to just support those cheek wrinkles. It is FDA approved to treat cheek wrinkles. And then I'm going to come down here. So those are all the areas that I want you to see. She does have some vertical lip rhytids here. I may get to those, I may not get to those, we'll see.